Hello, dear friends, I'm here with you. Sofya Dorinskaya, psychiatrist, president of the International Bureau for Human Rights and Mental Health, and head of the Medical Information Center of Sofya Dorinskaya. Today, I would like to talk with you about the topic: what makes so-called light drugs dangerous? I think you know that there is an opinion, especially among young people, like, so what if I smoked marijuana or hashish? It's nothing, it won't cause me any problems. Someone smoked, that's all. At first it felt good, then it got bad, the person quit, and so on. But unfortunately, experience and the careful collection of medical histories from people who come to our medical information center and my overall psychiatric experience show that the consequences of using so-called light drugs are actually very serious. And here I want to once again recall the work of academician psychiatrist Vladimir Nikolaevich Miasyashchi on the nature of predisposition, where he described how a person can acquire a tendency toward mental disorders. What exactly is an acquired predisposition or tendency toward mental health disorders? This typically occurs when a person has gone through the difficult experience of brain injuries, specifically traumatic brain injuries. Or perhaps he had endured a very severe period of illness, or a long period of total exhaustion, or even a significant period of extreme vitamin deficiency, or a prolonged period of severe psychogenic stress. He wrote about psychogenic factors during wartime, meaning things like bombings, for example, staying in a concentration camp, that is, extremely severe psycho-emotional situations that threaten a person's life. But as you understand, severe psychogenic stress can be different for everyone. In peacetime, the loss of a loved one, a person with whom your whole life was connected, can become such a devastating factor for one's mental state. Or, for example, some loan that a person cannot repay. He was thrown out onto the street from his only apartment, and so on and so forth. A husband left her with 2 children, threw her out into the cold. There are all sorts of different situations. So a person's body can develop a tendency toward mental disorders. What does this mean? If we're talking about biology, it means that the body's resources, a person's capacity to endure severe, exhausting situations, are essentially depleted. They're practically gone. Consequently, what this essentially implies is that if a person's blood sugar level experiences a sudden decline of approximately 10%, they can potentially begin to manifest symptoms of a severe neurosis or even a full-blown psychosis. It's important to understand this. When I talk about a drop in blood sugar, some people write to me saying, I had my blood sugar tested and everything is perfectly fine. I'm not talking about hypoglycemia, when the blood sugar level is below the minimum. At that point, you need to see an endocrinologist. I'm talking about fluctuations in a person's blood sugar levels throughout the day within the normal range. Can you imagine how much a person loses, simply lacks the resources to cope with difficult situations precisely when their blood sugar levels fluctuate during the day? And because of this, a person can develop, including psychosis, as they say, out of the blue. Or a person suddenly goes insane. A panic attack so severe that the person doesn't notice anyone around them anymore. They scream, they're terrified of dying, they say they're about to die. The ambulance arrives, everything is fine, there's no heart attack, nothing is wrong. It turns out to be a psychotic state. The person is taken to a psychiatric hospital, and it's considered that this is how the manifestation of schizophrenia occurred. But what I'm telling you now is a real case. When you start taking the medical history of such people, it turns out that several years before this, they had a period of drug use, specifically these so-called light drugs, smoking. And then after that, there followed a more or less prolonged, to a greater or lesser extent, exhausting period. In what kind of case? A person went to serve on a ship, went to work on a ship, and for 6 months he was at sea. Obviously, there were stressful situations there. Maybe he didn't get enough sleep, and maybe, I don't know, he argued with someone, maybe the crew didn't anything could have happened, right? So basically, there were heavy physical and emotional states. There was a certain period of exhaustion. In another case, the person had already received an education. After that, he started a family. And he went through a tough period when he worked a lot and did the construction himself. He was personally involved in the building process. And indeed, he would get very tired and, he didn't really watch his diet and so on. And in all these cases, I'm just telling you what comes to mind right now. And after that, we experience periods of psychosis. Some people end up in a psychiatric hospital with real hallucinations. Others suffer from severe panic attacks. As I mentioned before, sometimes everything seems fine, but agitation sets in, this state of terror and fear, when a person is restless even though nothing physically hurts. The agitation can be so intense that the person may be taken to a psychiatric hospital. Naturally, the diagnosis of schizophrenia is made. And then the next set of problems begins. Of course, the person is given antipsychotics because such a condition can only be managed with antipsychotics. But if a person happens to suffer from a serious organic brain disorder, and keep in mind that light drugs like marijuana or smoking various drugs directly lead to significant brain tissue dystrophy, the overall brain mass gradually decreases and the brain essentially shrinks in size over time. This process of deterioration is quite profound and impactful for the individual's health. Sometimes there may also be swelling and so on. In other words, the person also develops an organic inadequate condition of the brain. If such people are examined, they are always diagnosed with an organic disorder. This is actually called an organic brain disease. It is an organic inadequate condition. So, if a person has an organic brain disease and starts taking antipsychotics, it is practically a hopeless situation. When it comes to later combining it with antipsychotics, when I was studying, I'll say it again, when I was studying, I was in the last graduating class of doctors who were trained under Soviet programs. So we were told very clearly, collect the anamnesis, and if a person has an organic brain disease, antipsychotics are, practically taboo. With any others, of course it's clear that if there's absolutely no other option, then you do it, you prescribe them. But you fully understand that the person will practically never be able to stop taking them again. Unfortunately, in this case, it's such a combination, a fatal combination. So people, especially young ones who think, what's the big deal? I'll just smoke a little, I won't tell my parents. Well, they say it's nothing, it's fine. I want to warn you about what you're planning for yourself. You're setting yourself up for a very fragile future because the resources of our body are not given to us for nothing. Life is long and situations are different. And the human body needs to be strong and resilient, able to withstand various hardships, both physical and mental, to endure exhaustion, both physical and mental. And this resource is built into the body. When you start using drugs for fun, you take away this resource from your body and you develop a tendency toward mental disorders. Absolutely for sure, as a consequence, you will have an organically suboptimal state of the brain. And if in the future you end up in a situation where you are prescribed neuroleptics or antidepressants, then most likely you will never be able to stop taking them. And taking neuroleptics, antidepressants, and tranquilizers, this is absolutely certain. Taking neurotoxic poisons, which in addition to having a whole range of side effects, generally shorten a person's life. Please take an honest look at the truth and decide for yourself. Do you really want to live a long life? Perhaps not an easy one. But here is your body. It will be the instrument for living the life you create for yourself, or the one that is destined for you. Or will you destroy it right from the start? That very resource, and in the future, you will have to live in the position of, a disabled person who can't eat infrequently. That is, you have to make sure your blood sugar level doesn't drop. That means eating every 2.5 to 3 hours. It's hard, really, it's hard. You must not allow any violations of your work and rest schedule. You need to rest for 8 hours. You must not ever have any physically or mentally exhausting situations in your life at all. Ordinary things that happen to everyone on the planet, like the death of loved ones, financial losses, or harsh physical conditions. You need to earn money, you go away for shift work, working 12-hour days. All of that is no longer for you. In other words, from now on, you need to plan your life like that of a houseplant in a pot, which nothing should affect, with everything kept more or less within a 2 to 3 degree range of temperature. That is, your life will now be strictly confined within rigid boundaries, otherwise there will be serious consequences. I hope this video was interesting. I hope this video was clear. I hope this video was useful. I have answered the question of why using light drugs is dangerous. This was Sofya Dorinskaya with you. All the best. Goodbye.